Imagine the human body as a bustling metropolis where each organ system plays a vital role in keeping the city alive. Within this high-stakes environment, every system faces ongoing challenges, from invading pathogens to internal malfunctions. Just like a city's emergency services, the body's defenses are always on alert, ready to respond to any threat. Survival depends on the seamless cooperation and resilience of every part, working together to maintain balance and health. Deep within the arteries, a silent process unfolds as lipid plaques gradually accumulate along the vessel walls. This buildup, known as atherosclerosis, narrows the arteries and restricts blood flow. Over time, these changes can lead to a stable angina, a type of chest pain that typically occurs during physical activity or exertion. The body often adapts at first, but as the plaques grow, the warning signs become harder to ignore. A sudden rupture of arterial plaque can have dramatic consequences for the heart. When this occurs, it exposes the inner layers of the artery to the bloodstream, prompting the formation of a blood clot. This clot can partially block blood flow, leading to unstable angina. The heart muscle may become deprived of oxygen, resulting in chest pain and increasing the risk of a heart attack. Such events highlight the unpredictable and serious nature of cardiovascular disease. Bacterial infections can target the heart valves, leading to the development of vegetations in a condition known as endocarditis. These vegetations are clusters of bacteria, immune cells, and debris that can disrupt normal heart function. In contrast, rheumatic fever, a complication of certain infections, leaves behind distinctive lesions called Ascoff bodies. These remnants are a sign of previous inflammation within the heart tissue. Both conditions highlight the lasting impact infections can have on the heart's structure and health. The heart can weaken and fail through several distinct mechanisms. In dilated cardiomyopathy, the heart's walls become stretched and thin, reducing its ability to pump blood efficiently. Hypertrophic cardiomyopathy, on the other hand, causes the walls to thicken, which can obstruct blood flow and strain the heart. Restrictive cardiomyopathy makes the heart muscle stiff and less flexible, limiting its capacity to fill with blood. Each of these conditions affects the heart's function in unique ways, leading to different symptoms and challenges. Within the lungs, oxygen plays a crucial role in sustaining life. In conditions like COPD, the body's ability to exchange gases becomes impaired, often resulting in elevated levels of carbon dioxide. A state known as hypercapnia. Emphysema damages the alveoli, the tiny air sacs responsible for oxygen transfer, making breathing increasingly difficult. Chronic bronchitis, another form of COPD, leads to persistent inflammation and mucus production, causing individuals, sometimes referred to as blue bloaters, to struggle with chronic shortness of breath and low oxygen levels. Asthma is characterized by the narrowing of airways, which fortunately remains reversible with proper treatment. However, in severe cases, a crisis such as acute respiratory distress syndrome, or ARDS, can occur. ARDS leads to widespread damage of the alveoli, the tiny air sacs in the lungs responsible for oxygen exchange. This damage causes the alveoli to collapse, severely impairing the body's ability to take in oxygen. As a result, the condition becomes much more critical and challenging to manage. When infections reach the lungs, they can cause a variety of changes. Pneumonia often leads to consolidation, where the air spaces become filled with fluid and inflammatory cells. Tuberculosis, on the other hand, triggers the formation of granulomas, which are small clusters of immune cells that attempt to contain the infection. In sarcoidosis, The body also forms granulomas, but these are non-caseating, meaning they do not contain the dead tissue typically seen in tuberculosis. Each condition alters lung tissue in distinct ways, affecting both structure and function. The digestive system is not immune to disorder. Gastroesophageal reflux disease, or GERD, can alter the lining of the esophagus, leading to a condition known as Barrett's metaplasia. Meanwhile, the bacterium Helicobacter pylori is a common culprit behind painful peptic ulcers. Within the intestines, inflammatory bowel diseases create ongoing challenges as the immune system mistakenly attacks healthy tissue. Each of these conditions highlights the complexity and vulnerability of our digestive tract. The liver can develop scar tissue, a condition known as cirrhosis, which impairs its function over time. Hepatitis causes inflammation in the liver, further compromising its ability to process nutrients and filter toxins. The pancreas is also vulnerable, with inflammation leading to pancreatitis and disrupting digestive enzyme production. Meanwhile, the gallbladder may form cholesterol stones, which can block the flow of bile and cause significant pain or infection. Together, these conditions highlight the interconnected health risks affecting the digestive system. The kidneys play a crucial role in filtering waste from the blood, but when they begin to fail, several problems can arise. Acute kidney injury is often marked by a sudden increase in creatinine levels, signaling a rapid decline in kidney function. In contrast, chronic kidney disease develops over time, leading to a gradual reduction in the glomerular filtration rate, or GFR. Additionally, certain kidney syndromes can cause the loss of protein or blood into the urine, further compromising the body's delicate balance. These changes highlight the importance of healthy kidney function in maintaining overall well-being. Certain kidney diseases are notable for their distinct patterns and associations. In children, minimal change disease is a common cause of nephrotic syndrome, often presenting with sudden swelling and protein loss in the urine. Focal segmental glomerulosclerosis, or FSGS, is frequently linked to HIV infection and can lead to progressive kidney damage. Membranous nephropathy, on the other hand, is characterized by immune deposits along the glomerular basement membrane, resulting in a gradual decline in kidney function. Each of these conditions highlights the diverse ways in which kidney disease can develop and progress. When metabolic processes go awry, the body faces significant challenges. Diabetes can damage blood vessels over time, leading to serious complications. Acute emergencies like diabetic ketoacidosis and hyperosmolar hyperglycemic state can develop rapidly, requiring immediate medical attention. Additionally, hormonal disorders can upset the delicate balance of metabolism, affecting energy levels, the speed of bodily functions, and calcium regulation. These disruptions highlight the complex interplay between hormones and overall health. Osteoporosis and osteomalacia are conditions that compromise bone strength, making bones more susceptible to fractures and deformities. In osteoporosis, bone density decreases, while osteomalacia involves the softening of bones due to defective mineralization. Meanwhile, certain tumors, such as pheochromocytoma, can remain hidden within the body, releasing sudden surges of catecholamines. These hormone bursts can cause significant spikes in blood pressure and other serious symptoms, often making diagnosis challenging. Joints can be affected by a variety of conditions, each with its own unique challenges. In rheumatoid arthritis, the immune system mistakenly targets the joints, leading to inflammation and pain. Osteoarthritis, on the other hand, results from the gradual wearing down of cartilage, causing stiffness and discomfort. Gout is characterized by the buildup of uric acid crystals within the joint, often leading to sudden and intense pain. Additionally, some autoimmune diseases can cause dryness in joint tissues, further impacting mobility and quality of life. The brain is vulnerable to a range of neurological threats, each with distinct impacts. In multiple sclerosis, the protective myelin sheath around nerve fibers is stripped away, disrupting communication between neurons. Parkinson's disease is marked by a depletion of dopamine, a crucial neurotransmitter for movement and coordination. Alzheimer's disease leads to the accumulation of beta amyloid plaques, which interfere with cell function. Meanwhile, Huntington's disease progressively destroys neurons, severely affecting both movement and cognitive abilities. The brain can be affected by a range of vascular events and traumatic injuries. Strokes and subarachnoid hemorrhages disrupt normal blood flow, often leading to sudden neurological deficits. Epidural and subdural hematomas result from bleeding around the brain, typically following head trauma. Infections such as meningitis can inflame the protective membranes, while tumors may exert pressure or mass effect on surrounding brain tissue. Each of these conditions poses significant risks and requires prompt medical attention. Cancer stands as a formidable adversary within the body, taking on many forms. Leukemia disrupts the normal function of bone marrow, while lymphoma spreads through the lymphatic system. Solid tumors can develop in vital organs such as the breast, lung, prostate, colon, cervix, and skin. Each type of cancer presents unique challenges, making early detection and targeted treatment essential in the fight against this complex disease. Blood disorders can significantly complicate the body's delicate balance. Anemia lowers the amount of oxygen delivered to tissues, while polycythemia causes the blood to become unusually thick, making circulation more difficult. Thrombocytopenia, a condition marked by low platelet counts, heightens the risk of bleeding. In disseminated intravascular coagulation, or DIC, the body's clotting factors are rapidly used up, leading to both excessive clotting and bleeding. Additionally, genetic disorders can further disrupt normal clotting processes, adding another layer of complexity to blood health. Systemic crises can have profound effects on the body, often overwhelming its natural defenses. Sepsis, for example, triggers a widespread inflammatory response known as SIRS, which can rapidly affect multiple organ systems. Anaphylaxis is another acute reaction initiated by IgE antibodies, leading to life-threatening symptoms within minutes. Additionally, the body can experience several types of hypersensitivity reactions, each with distinct mechanisms and consequences. Understanding these responses is crucial for timely recognition and intervention. Within our bodies, the fate of each cell is determined by a series of complex processes. Apoptosis is a controlled mechanism where cells are programmed to die, ensuring healthy development and maintenance. In contrast, necrosis is an uncontrolled form of cell destruction, often resulting from injury or disease. Cells can also adapt to their environment through changes such as hypertrophy, where they grow larger, hyperplasia, which involves an increase in cell number, metaplasia, where one cell type transforms into another, and dysplasia, marked by abnormal cell growth. These cellular responses are fundamental to both normal physiology and the development of disease. Cancer arises when the genetic balance within cells is disrupted, Oncogenes act as accelerators, pushing cells to grow and divide uncontrollably. In contrast, tumor suppressor genes such as P53 and RB function as brakes, working to halt abnormal growth. When these protective mechanisms fail, cancer cells can gain another advantage through the activation of telomerase, an enzyme that allows them to divide indefinitely. Together, these genetic changes enable cancer to develop and progress. The human body is a remarkable arena where countless systems work tirelessly to maintain harmony. Each day, our organs and cells coordinate to keep us healthy, adapting to new challenges as they arise. When disease strikes, it introduces unexpected changes, testing the resilience of our internal defenses. This ongoing struggle for balance highlights the complexity and determination inherent in our survival.